My path to orthopedics kind of stemmed just from interest I had. I really like solving problems, and most of the time when people come to clinic, we have a problem. And my goal is always to work to fix that problem. And the nice thing about orthopedics is usually you can fix that problem. Sometimes it's just improving it, or sometimes it completely goes away. Whether that's through conservative measures or operative measures, we can make that problem and take it and make it better. And I know everyone says this, but I truly treat every patient like I treat my family. So when I make a decision, I want them to make the same decision I would recommend to my brother, my mom, my wife. And I don't treat them as anything different than I would my own family. So I have a special interest in the hand and upper extremity. So after my general training, I did a fellowship in hand and upper extremity surgery, specifically hand surgery, elbow surgery, and shoulder surgery. But I'd say the most common things I see are carpal tunnel syndrome, trigger fingers, arthritis, and fractures of the hand. I really enjoy fractures of the hand and trauma. I actually spent some time in Germany as well, doing a specialized fellowship in hand trauma over in Europe to learn from some of the masters over there as well. The most common advice I give my patients is to ask questions. I think medical care can be complicated and confusing to a lot of people, and they come in with a problem, they don't really know why it's causing that. And my goal is to educate the patient and let them know what's going on, and hopefully give them some advice. And then once we have a great understanding, but both of us know what's going on, then we can work together as a team to figure out what the best approach is. I perform carpal tunnel surgery through a minimally invasive approach. So historically, carpal tunnels were done through a big open incision in the palm. Lots of sutures required, patients had pain in their palm for a longer time. And the techniques have evolved, and now we can do carpal tunnel surgery through a very small incision at the base of the wrist crease. Sometimes no sutures, or sometimes 1 or 2 sutures are involved. We do the same release, patients get the same relief from it, but their pain after surgery is much less, they're back to work faster, and their recovery is much faster.